joining us. Today we will be speaking about manufacturer portals and hub utilization. Moderating this will be Mike Daugherty, Manager of New Product Access, Reimbursement, and Launch. Mike is an experienced patient finance manager with over 10 years of hospital experience managing a diverse patient services team comprised of financial counselors, patient access specialists, and patient financial advocates. Mike also brings 2 years experience managing the operational and strategic patient services launches within the hub services realm. Mike has a passion for patient-centric service models. This drives his commitment to ensuring a seamless experience for all patients, their families, and their HCPs. Thank you, Mike, for joining us.
You're most welcome. Thank you. Hello and welcome to you all. Welcome to the Healthcare Advocate Summit webinar series, a panel discussion on manufacturer portals and hub utilization. Today, you'll hear from 3 individuals who has extensive experience utilizing hub services and manufacturer portals. You'll hear their perspective on what works and what can be improved. So hi, Keny, we're going to start with you. Can you tell us a little bit about yourself and where you feel the greatest opportunity to improve is for hub services?
Hi, everyone. My name is Keny Urbina, and I'm a field reimbursement manager. Though my background is as a biologic coordinator, I have over a decade of years of experience working in the infusion space, where I was responsible for multiple authorizations, follow-up with claims, and working with various portals.
Thank you so much, Keny. Now we're going to move over to Natalie. So hi, Natalie. Can you tell us a little bit about yourself and what you feel is the most important service that a hub provides?
Sure. So my name is Natalie Foss. I'm the Medication Assistance Program Supervisor for UnityPoint Health. We are a health system in the Midwest. We have a team of 8 advocates and assist patients across our infusion centers and specialty pharmacy and clinics. We assist patients with infusion, medications, injectables, and oral medications. A good thing that I really like about the hub services is they do offer a wide variety of assistance and look at every aspect of what's available within their scope and possibly what is available that is based off of a patient diagnosis. And there are times where they will find things that we are unaware of, and they will assist in making sure that we are taking the right route for the patient and their needs.
Thank you. Sounds like you have a really important team that you work with.
Yeah, we do.
Yeah. All right, so we're going to move to the question and answer section. So Keny, coming from a practice and now moving into a field of reimbursement role, what would you like your offices and the advocates in those offices to know?
I think most importantly, what I've learned in my previous experience was that sometimes we want to have full control of our process, and each advocate has their own way of handling things. We have our own system, and we have checks and points that we realize are important. However, as our practice grows and we get additional patients, it's a little tough to keep track of every single patient and where in the process their medication is. So at first, when portals were new to the industry, I will admit I was hesitant to give away my process and just trust that the pharmaceutical company knew what worked best for my office. However, once I gave full control to the portals and utilized their services, I saw a huge change, not only in my stress level, but also in the process and how quickly and efficient it was. And just something that I would like my advocates to know out there is that you have options of giving full control in terms of using every service that the hubs use, or you can have certain features that you can turn on and off. And there's multiple benefits of using the portals You can do anything from having pre-populated forms to having your patient sign e-signatures, your provider sign e-signatures, as well as just a checklist of what patient is on treatment, and just an easier and effective way to start authorizations right on the portal. And it just takes away the faxing issue. Did they receive it? Is there a confirmation? And a bunch of paper, to be honest, on your desk. Personally, like I mentioned, I was hesitant because, like everyone out there, you feel like your process is the best process. But later on, I realized if I need my patients to get on therapy quicker, then I really have to rely on the portals out there, because that at the end of the day, that's their goal, and it's the same as mine. So I converted many of my paper enrollments into online portals, and I didn't, honestly, there was no turning back after that. So I would tell my advocates to, give it a try, and you'll realize that you'll save a lot of time and it's a lot more efficient.
Thank you. So thinking about the services that the portals do offer, and kind of the a la carte services, what was the service that you found most useful in that a la carte menu?
Honestly, I can always turn back into the end of the year verification. At the end of the year or at the beginning of the year, we have this thing where it was called, oh my goodness, the blizzard. And the blizzard was another way of saying, like, you have all these cases, patients that are changing insurances, and that they're going to be coming into your office. They'll be calling, knocking on the doors, needing to get treatment. And the best way to assist these patients is to get their coverage at the time and know if there's any change with their deductible, if an authorization is now needed versus last year it wasn't. And there's only so much you can do. And this is the point where you need to rely on the portal and your services. And a lot of hubs have the end of year re-verification, and they offer that at the beginning as well, where they verify all of your patients. All you really have to do is hand over any updated insurance information. And they also themselves, they call out to the patient or have their nurses call out to make sure that there hasn't been any change. So they're there to help you. And it's such a critical time in a patient's therapy that there's no need to break therapy when you have when you have services that can help you during these critical times. So for me personally, it was the end year verification, as well as just the on-demand type of field that it gave, where it's just a click away. Another feature that I love is the downloadable forms, and that they're pre-populated. So you're able to do appeal forms and start patient assistance programs with the information that is already in the portal system. So you're able to save time, and you can just fax it through the online system, like their e-faxes, and it's a time saver, and they'll keep track of everything, and they will let you know. So for my advocates out there, I say, if you haven't signed up to a portal, definitely do. You will realize that it's going to help your process overall.
Very good, thank you. So I'm just had me kind of thinking through my experience as well, and my favorite part was the what you touched on earlier, the knowing the status of the claims through their portal. Right? So we don't have to continue to call and have agents that could be helping patients on the phone with the manufacturer portal to find out where's this payment, where's that payment. So in my experience, that was my favorite part of the portals.
Yeah, I have to agree.
So what suggestions would you have for new advocates using portals?
I suggest that if you feel like it's going to be overwhelming since you haven't used one before, just know that there are features that you can turn on and off. And as you get familiarized with the portal, you can start turning on the features, as well as just play around with it. Know that there are certain features that, for example, if you have a nurse that calls on your patients to check on deliveries, you may not necessarily need a delivery notification within your portals. So overall, just look at your process and see where it is that you may need the assistance, because that's what the portal is there to do, is to be a backup to your system and not necessarily changing your entire process.
Yeah, that's some solid advice. Thank you so much, Keny.
Thank you.
Natalie, so I'm going to throw a question over to you. So thinking through your day-to-day work, how many portals do you work with daily? And then on that same point, what are some of the challenges that you run into with a single manufacturer?
Okay. So thank you for having me. And so typically the advocates run about a dozen portals a day. We're running portals with drug manufacturers as well as foundations. So we're working with copay assistance on multiple medications, free drug, and then foundation assistance then for those patients who are Medicare age. So I know at times when I was working as an advocate in the field, I had about a dozen, or not a dozen. I had about a couple dozen, up to about 50 portals that I was utilizing, just helping out, assisting, things like that. And I know the advocates have about a couple dozen as well, 24, maybe up to 30 portals that they're utilizing, not on a daily basis, but overall. So
A lot of passwords to
a
keep
lot of
track of.
passwords. Yeah. So we do our best to try to make them as simple as possible. Sometimes it's very easy passwords, I hate to say. I keep a spreadsheet, and I am constantly updating my spreadsheet with passwords. And if I have to update it with my EMR, I try to update them with the same password with my EMR with some of the portals, so I don't forget it. But it's super challenging to try and stay up with that. So the challenges that we have with portals, a lot of it is going to be basically uploading documents. That is a huge challenge that we do have. Not every portal has that option, and we are needing to upload EOBs, UBO4 forms, 1,500 applications, income documents, things like that. And not every portal offers that option to upload documents. So that is a really huge challenge for us. Another thing is not being able to track the process. We really need to know what's happening with our application, or our the status of our UBO4 forms that are sent in, and our EOBs that are sent in. Where's the copay assistance for this particular patient? We hold accounts within our EMR, so we can make sure that the patient doesn't receive a bill or go to collections until we get copay assistance. So we try to get this done in a timely fashion. And if we don't know what's going on, we're on the phone, just like Keny had talked about. We're talking to the manufacturers on a constant basis. What's the status of the application? What's the status of the documents? And where's the check? What's the check number? How much was approved? There's times where we're having to call and we're on the phone. Oh my gosh, like it can be up to an hour and a half. We're sitting on the phone, especially now with everybody working from home. We're having more challenges reaching out to people, reaching out to those manufacturers to get that information. So those are some of our main challenges that we have with the portals.
Yeah, I can relate. So, especially around the faxing of all the information to have it reviewed for approval, I found it really frustrating to fax that and then get notified 2 days later that the faxed image didn't come through clean enough and they couldn't read it. So
Right.
then we have to refax it again.
Mm-hmm. There's times where even we'll use the fax, we'll send a fax in, and not only did they not read it, but then they're going to say a week later, we didn't receive it. And so now we are a week behind and we're refaxing documents. So having the option to upload documents on a portal really is just compliance then with, trying to get everything taken care of, with the patient. They're not having to worry about what's going on with my bill. Why isn't the manufacturer paying? I signed up for this. So really just trying to make it a more straightforward and smoother process is so beneficial, way better than faxing.
Yeah, absolutely. No, it is a great benefit when the manufacturer does have that ability. So, is there something that you would like to see the portals incorporate that could better streamline your team's daily workflow?
Uh, I think my biggest suggestion is if the manufacturer with their portal, if they have multiple medications that patients could kind of piggyback off of. So some drug companies offer, a patient could be on two drugs from the same company, getting free drug or getting copay assistance. Been times where we've had to we have multiple logins because each drug has their own portal, and it's very frustrating for us. We're submitting the same EOB in two different portals. I know that we have work with a company who has a portal that has all the manufacturers or all the drugs that they offer, and then they also have a separate portal for another drug that they have based off of a different diagnosis. And now you have multiple portals for the same drug. It's very confusing.
Hmm.
So one place, one application per company would be super beneficial. I've seen most recently copay assistance application for the same company, different drugs, and they are completely different. And they're asking for very in-depth clinical information on one, and the other one is like, what's your diagnosis? And that's it. So, having one application for these drugs, and again, they have separate portals. So if we had a same portal then for one manufacturer, we're not going to have these issues. And it doesn't necessarily have to involve a patient having taking two drugs from one company, even just for our access and our ease of our workflow, not having to have a million portals that we're logging in. So
Yeah, that actually made me think of a patient that we assisted that was on 4 drugs and 4 different manufacturers. So it was a login for each claim into each portal to submit all the same documentation for each drug. So yeah, that it can definitely be difficult and time consuming. And if you miss one, now you're going back to try to get that repaid, and yeah, it can
exactly,
be definitely difficult.
exactly, yes.
Thank you so much for that.
You're welcome.
So, what barriers do you run into when a manufacturer doesn't have a portal?
Oh gosh, everything. The faxing situation is absolutely unbearable. Um, we will fax documents, and again, we will check on it in like a couple of days. We try to give it some time, and they didn't get it. They didn't receive the fax. Even if we get the confirmation sheets that says, okay, it went through, here's your timestamp and things like that, and they go and search in their system, um, and they can't find it. So not having a portal really does, and having to fax things really puts a dampener on our process. I had one advocate who was starting to just mail in the EOEs and UV04 forms because it was actually faster than having to fax it.
Wow.
And who knew, right?
Right.
It was actually kind of comical because we were even suggesting that to other advocates. If you can't get through to with a fax and they're having these challenges, just mail it to them. And having a portal definitely would be more beneficial to help ease that process. Also, the following of the checks. I cannot tell you how many times we've called into manufacturers and we're asking, where's the money, essentially? Where's the check? What's the date of the check? What date was it written for? What date was it mailed? Did it get cashed? We're asking all these questions, where as if we had an online portal and they had that information downloaded on there, or they had a card or an e-card, either a physical card or an e-card. We wouldn't be asking these questions. We could get these payments pushed through as fast as possible within our EMR so we can get the bills out to the patients. Or if there is no remaining balance, then we can just move on to the next month. So having the payment information online and also having the option of a physical card or an e-card, that's a lot better option. All around in every aspect. So, and I'm sure you could agree, and I'm sure Keny could agree as well. And any advocate who works with the manufacturers would feel that this would be super beneficial.
Yeah, I couldn't agree more. It was, and sometimes I wondered if the hub services understood that, hospitals don't have a single person that does the collection and the billing and the posting and, going to the mailbox to get the physical check, right? That it's sometimes 4 or 5 different departments that are handling that. So yeah, it's really beneficial, I think, to have that information online, or that the e-card, I think, is probably the easiest one that I ever ran through. Right?
Yeah.
To process it like a credit card and keep on moving.
Yep. Having that information on a portal online is amazing when it's available, or even just having the check information is as well. But when they don't have a portal to offer it, it just makes it more challenging.
Thank you. So Keny, I'm going to throw another question to you. So when you were Biologics coordinator, how did you find out about the portals?
It came at a very stressful time. I was in a place where I had a lot of patients that I sent over to the specialty pharmacy to handle their benefit verifications and just make sure that my patients were being taken care of. And I did that for many years. And then there was just a situation with the specialty pharmacy, and they were no longer servicing my patients. So I did not know what was going on with my patients, if they got transferred out to another pharmacy. And to be honest, I forgot what patients were treated with particular products. So I had to call on the hubs and work along with my field reimbursement managers to give me a list of the patients who are active on the product. And after weeks of trying to figure out what patient belonged where and if they were utilizing the services provided by the pharmaceutical company, my field reimbursement manager told me that there was an easier way and that I was missing out on the portal aspect of it. And even though I've heard of the portal, like I said, I just wasn't ready to change my process. And it made me realize during a really tough time that I needed to transfer my patients from the specialty pharmacy into a portal. And I started utilizing the portals and signing up patients to co-payment programs and services that honestly a lot of specialty pharmacies may not even let the patients know that there are these types of services. And then I just called every field reimbursement manager out there and said, hey, do you have a portal? And if so, sign me up. And that's where it all began.
Awesome. Yeah, thank you. That's through my experience as well. We had a really difficult time having field reimbursement managers come into the hospital, but we had a really great sales rep who introduced us to the field reimbursement manager, who introduced me to Hub Portals. And like you, it kind of once I trusted, it kind of took off like a disease and just kind of spread through all of my team, and everyone wanted to use it, and it was really really helpful to make sure we could service as many patients as we could possibly manage, right?
Yeah,
Great, thank you.
exactly.
So I'm going to move to the final question. This is going to be the same question for everybody. Keny, since I'm with you right now, we'll go ahead and start with you. Can you just give a quick final closing remark on what you would like the audience to know?
Most importantly, that you're not alone in the process. Sometimes we may feel like we have to take the entire work on to ourselves in order for it to be processed correctly, done correctly, and just to keep tabs on it. And I think that is the hardest part of our roles, is that we put ourselves in a position where we make ourselves accountable for everything that happens. If a patient's medication is delayed, could we have done something differently? And we're hard on ourselves, which makes it harder for us to really rely on these services that the pharmaceutical companies provide, such as the hub, the utilization, and utilizing key stakeholders like your field reimbursement managers and your sales reps out there. If we relied more on them, we would be able to ultimately help our patients get on their therapy faster, because we will know when a certain program is being activated, and we're more vocal on what is needed to help our process. We'll build a relationship with the company, and they'll hear what we need, and they'll make the changes required to help our process at the end of the day. So to my fellow advocates out there, I would say, just trust that if you were to use the portal, and that there are ways that you can make your work efficient and expedite the process as well. And you're relying on a team of people whose goal is to help the patients just like yours.
That's some solid advice. Thanks, Keny. So Natalie, same question to you. Can you give us a quick just closing remark and what you'd like our advocates in the audience to hear?
Absolutely. So I cannot echo enough of what Keny had just said. You're not alone. We're across the country, and we're all trying to help help our patients. And definitely reach out to your hub, your field reimbursement managers. And if you don't know who they are, find out who's doing the drug contracting, and they are meeting with the sales reps all the time, and get a hold of the sales rep, and they can get you a hold of the right FRM that is in your region. So that is something that I've kind of leaned on myself and try to find the right person, or call the hub. Call them and ask them, and who can help me with this. And not only that, just attend, the Healthcare Advocate Summit and listen to these webinars. We're available to help too. We're across the country. We're in the same boat. We've seen it all. We've done it all. I have reached out to, many of colleagues on this in this group, and it's been very helpful to try and just get the small things taken care of. And the quick question, hey, do you know of somebody that does oncology here or whatever? So, really just rely on that network of advocates, and know that you're not alone. And definitely use the portals. They are going to be they're going to be the best thing that you've ever utilized with the drug manufacturers. And if you're having challenges with the portals, don't be afraid to voice your frustrations to them, because they want to help you. They want to make sure that their product and their portals are going to be the best of what it is for the patient and their client, and because they also know that you're not the only one who's utilizing these portals. If we're having the problem, other people are having the problem as well, and they want to make sure everybody's happy.
There was some really great messaging from both of you that I think really cuts to the point of kind of what we are here at the Healthcare Advocate Summit, and that's just a partnership, right? We're all here together to help each other, to help our patients. And I think the message of "you are not alone" is a very strong one and a very powerful one, because it's true. You are not alone. You may be alone in your office, but there's a whole world of people out there that are willing to help and help your patients. All right, so wonderful. Thank you guys for tuning in to our webinar on manufacturer hub services and portals. And I hope you guys have a wonderful day.